All right, well, good morning, everybody. In the interest of preserving everybody's time, I'll go ahead and get started today. It is a wonderful July day, so I feel like attendance will be a tiny bit light today. Everybody's probably watching the Tour de France or something like that. I don't know if that's still a thing. Do people do that? Tomorrow is Bastille Day. Anyways, gonna run through our July meeting here. I am flying solo this morning. Doc Laffey is lecturing, and Trish is hanging out in a treehouse in Kentucky, maybe, if they're all still alive. So hopefully she has a good vacation. Run through our welcome and introductions here. Is a good looking group of people, as always, attending. So thank you all for being here. As always with Zoom, I won't make us all try to unmute and talk to each other, but like I said, certainly a good looking group of participants. So we're going to run through and give some kudos. Did have a couple of good things happen here over the last month. I actually wanted to give a shout out to Medic One, and this isn't going to be regarding a transport, but a great idea from one of their crew members, and I'll show you that shortly. We had a good transport scene flight with Lytton and Arch that got an actively seizing kiddo to us, and I'll show you some of the excerpts from that trip sheet. And then I wanted to thank Stoddard County, who got a stoma save on one of our long-term kiddos who's been in from the beginning. So they did an excellent job at taking care of him and helping him avoid a long transport up here. So this was the idea that came to us from Medic One, and sort of an interesting idea, and also to show you that we do listen, and we appreciate all the ideas that are shared with us from all the providers in the region. So we were out teaching at Medic One, and one of their paramedics said, well, so backstory, Medic One handles a lot of our out-of-hospital transfers from Glennon, especially our trach kiddos. And so one of them brought up the point, he's like, this would be a lot safer if we just had a checklist before we left with one of your kids. And so we thought that was a great idea, and this is currently being implemented in our hospitals. So as always, just appreciative of people thinking things through and trying to come up with the safest way to do things. I love this field, and I know we all like to fly by the seat of our pants and hold it all in our heads, but safety lists do actually play a huge role and can have a big impact. And this idea, I think, will save some heartache down the road somewhere along the way. Like I said, I would just share with you a little bit of excerpts from that flight or that scene call. Just a few things I love about this call, and you guys are more than welcome there. We have the video up. Me and Gene actually covered this in our call review, but just like I said, I want to share a few parts that I really like from this. They did involve mom. We had a patient who is really prone to status epilepticus and has some atypical presentation, and I like the fact that they included mom in their decision making and really kind of confirmed, yeah, we think these are seizures, and so this happened on scene. Something else that I really like from this call, that and I know agencies and providers are doing this across the area, but they specifically referenced where they got their dosing from. As always, I don't care what system you use, but we do recommend using a system when dosing the PEDS patients, especially because seizure medication dosing is it's a place where we just see providers are all over the place. Unfortunately, we see a lot of poor dosing. So they just specifically said, hey, we gave this dose and this is where we got it from. And I think that's just good documentation and a good way to handle that. You can see, so they did administer a benzo on scene. They did lift from the scene, and this obviously with Arch, they had enough room. They were able to bring mom with them. So they had maybe the unique situation of, while in flight, having mom there to say, hey, we think she's having that seizure again. Can you confirm? And mom did. And she was also able to supply that the kiddo had missed her daily Keppra, and so the crew initiated Keppra on the way here as well. Once again, noting where they got the dosing from. And then they ended up having to administer another benzo en route, but by the time they arrived, they did have cessation of seizure activity. The kiddo was briefly monitored in the ED, admitted up to the floor, and was checked out by neuro before being sent back home a couple days later. So just all in all, a lot of good things about this call, and I really like their documentation. I think there's always things we can take away from other providers and how they do it, and I thought they did a great job on this one. If you guys ever get a chance to check out the video from that call review, I won't share it here, but I will also say a spot on radio report, which has always been one of my things. So I like a good radio report to the hospital. We did see a couple things over the last month, just some room for improvement notes that you could maybe share with some of your providers. So one thing that I write into a lot of the STARS reports, and I feel like I know Gina's on here, I feel like she probably writes it in there too, is for some of the higher risk, really brittle kids, we always write this like kind of generic note like, please watch them closely, or, they need in-tidal CO2 monitoring throughout transport. And some of that's just because a lot, these kids are a little bit more at risk physiologically, they decline quickly. And I decided I might have to follow that up with not only should you monitor them closely, but you need to at least maybe address it in practice, or at least note in your trip sheet. If you turn in a trip sheet with a monitor that records all your vital signs and gives it to us, I just would like to see maybe in your trip addressing, a sudden decrease in heart rate, a sudden drop in SpO2, a sudden rise in CO2. This could all be explainable on the call, and for all I know, it was handled on the call. But once again, just sort of that touching on documentation or patient care practices of like, hey, if you see a 2-minute significant change in your vital signs, that's probably worth addressing in your trip sheet, and maybe addressing in your patient right in front of you. So that was just something we saw as part of that call review. And I have the dates later. Me and Gina are going to do a couple more call reviews later this year, and they seem to be, I think people like, getting to learn from each other and learning from both documentation and from a practice standpoint. And that's something we like to provide. If you have any crews who run a call that you think would be a great trip sheet for us to look at, we are always more than open to adding those to our call reviews. One other room for improvement that I was just going to toss in here, and I'm going to spitball on this one just a tiny bit. I'll leave all the details out, but I think there's a couple takeaways from it too. So as part of STARS, we do get a chance to interview our parents a lot. And sometimes things come out of that, and it's always from the parents' perspective. I get that they don't always understand the medical side and what we're doing. But we did have an incident where EMS was transporting in a kiddo, a lot of oxygen desaturations, and EMS decided they were going to intubate. It was of note that mom explicitly asked them not to do that. She was riding with the crew, and she said, hey, if she does this, I would really prefer you not do that. She's, the hospital has trouble with her tube. And so the crew on an approximately 30-minute transport pulled over to the side of the road and stopped for an additional 8 to 10 minutes to attempt an intubation that then failed. And then they transported the rest of the way in. And so, like I said, I'm not going to hound from their shoes. Maybe they, from their clinical perspective, said, hey, an intubation is absolutely warranted here. One of the takeaways, though, I think, is that it's really important how we talk to our parents, because this mother's perception was that they did something she asked them not to, and then she also felt like they didn't adequately explain what had happened to the receiving facility. And then she had to turn around and be the patient advocate and the care provider explaining to the ER staff, what had happened and that it had been a failed intubation. And that's why the kiddo had some extra trauma to her mouth. So, like I said, a lot of learning lessons here and things that are being taken up directly with that agency. But I think something that we can all share with our other providers is it's really important. Like, it's okay if everything you see in front of you says you need to intubate, but like really own that and really have the ability to address that parent and explain what you're going to do and why you have to do it. And then also own your failures, and don't make that parent have to explain to further staff downstream why maybe there was a poor outcome or as part of the patient care. So yeah, it may be a bit of a newer provider. I think a lot of room to learn, and we'll address that specifically with that agency. But I thought that was the takeaway we could all take and maybe share with some of our other providers. is, really working on, we're going to have to do hard things. And when you're talking about high risk special needs kids, you might have to do those in front of a parent, but really working on our ability of, okay, how am I going to talk to the parent about what I'm going to do as part of my practice here. All right, so enough about room for improvement. I did want to talk about contracts briefly. I know the last couple months we've touched on this each month. And I just want to say, courtesy of some feedback we got from EMS agencies, there is now a separate EMS STARS contract. So especially for any of my admins or for anybody who knows of a district who was struggling with this, we did write a separate EMS contract. Unfortunately, the primary or the original contract was aimed at both hospitals and EMS, and therefore some of the language didn't really pertain well to EMS. We did decrease some of the cyber liability requirement, and the indemnification clause has been altered a little bit to kind of more towards curtail towards EMS's role. For anybody who signed a contract within the last year, those are good for 3 years. And if you're fine with it, we certainly can just update again when it comes around. However, as far as if you for any reason, if your agency had to take on extra insurance, or you feel like you guys had to alter your finances to sign the contract, I don't think that happened. Most of those agencies addressed us and we changed the contract form prior to this. But if that happened at all, please reach out to us. We'll get you on the new contract, and we'll get that squared away. So obviously you can contact me or Morella about that, and we will address. Morella, if you don't mind dropping your email into the chat, so people will have that for me. All right, just going to run through the numbers from last month real quick here. So we had 19 transports that we know of, kind of ran the gamut. We did have a trach plug. It was fixed by the family. We had a couple other seizure calls, like I said, especially that you saw the one with the treatment. And then a couple other where just crews did a good job of managing some trachs. There were no emergency trach changes, but just kind of some classic sick cases. And they did a good job of getting them to us. And then we actually had 4 refusals that we know of for the month of June. So as always, we kind of are continuing to work on our understanding of that and how many of those are occurring. So please feel free to share those with us, and we will add them to the stats. We had 8 calls sent out by the dispatch system in the month of June. And then our emergency activations, you can see, I can't tell if we're leveling out yet or not. I will say we've been adding a lot more kids, as you'll see in the next slide. So of course, over time, we'll expect these numbers to start to rise here. And then we added a total of net gain of 8 new kids for the month of June. I guess it feels like a lot more to me. I think you'll see a July jump as well. And then we have had a lot of medical directors in and are approving. So as far as you know, that's pretty good numbers. We're continuing to work on our capture on that front. And then I was going to give out the attendance award. I always love to be beat, and I was beat multiple times last month. So kudos to everybody who has been getting in, checking on their kids, the dispatch agencies who are logged in and ready to go with STARS, and then of course some of our agencies continue to do that as well. So as always, a shout out to everybody who is working on this front. All right, application updates. The only big thing I had, so we did put in user verification last month. Everything is rolling officially, and so anytime you add somebody new, if you just add, by email address, they'll get the classic, you have to verify, just like every other app or website we use in this day and age. They'll get a security code to that email, and then they can verify it whenever they log in. If you add a phone number for them, the same will happen with the phone number, as well as they receive a text message to that mobile phone number, and then they have to put the security code in for that. So that is in place for any new user added. And then also if you alter any of your current users. So if you go in and change a password, or you change an email address, or you change a phone number, you will get prompted, or they will get prompted whenever they log in to verify those devices. So just a way, you know, of making sure that we have accurate phone numbers and emails in there for people who are accessing a system that does contain some PHI. So, so that is all in progress with the application. We do have some training opportunities coming up. So like I said, these are the dates for the next call reviews, and me and Gino will get a flyer out for those for the rest of the year. If you have any calls you want reviewed, please submit them to us for that. I also wanted to give a shout out to our EMSC team, who are doing a lot of different training, and they have seizures coming up. So I know some of you are probably familiar from the other meetings. But the way they're doing it currently this year is they'll have one session where we all kind of log in and get to hear from one of the expert docs in their field, and then we'll log in. Then they'll have a split sessions the following month where we get put into different classrooms and we try out different scenarios and talk about treatment. So they're using a number of us from the STARS teams for that. And so just it's more free education. EMSC is doing an amazing job of trying to really kind of pull education and pediatric readiness forward in the state. So feel free to please take some of their trainings. And then for some classroom stuff, we'll be out and about. So just always a reminder that we are getting back out and doing some more education in the classrooms. And if you guys have any requests or anything coming up that you need us for, please just reach out. Trish and I and Doc Laffey and a couple of other people will be working on a pre-conference for Priority One as well. I do have to, it does cost money. So, you know, as always, I don't know if I have an interest. I think I just told you my interest. Anyways, if you have any interest, though, we have 5 different sessions. They're being run by some extroverts who have informed us on the kids and the different things we write into the STARS plans. And so, like I said, certainly don't feel beholden, but just another opportunity to get some learning on different things that we are doing. So, all right. And that is the majority of what I had for today. Once again, I talk too fast. I probably don't ask enough questions, and I definitely need to reduce this from a 45-minute time window to a 30 at least. So was there anything that anybody had any concerns, any problems they're having with the application, anything like that? Oh no. My monotone voice put everybody to sleep this morning.
Never, Nick, never.
That was the only feedback I got as a PHTLS instructor. The only thing I can improve. Don't have a monotone voice. Anyways, all right. All right. Well, if nobody has any questions or concerns, I'll hang on here for conversation. If anybody has anything else, but other than that, please have a good day. Have a good week out there, and we'll see you again next month. Actually, Mr. Kyle Meadows, if you don't mind hanging on, I had just a question for you too.
Sure thing.
Yeah, I was just gonna touch base with your dispatch. I saw they had set up all the truck phones, but I think they just did it after user verification went in. So I just wanted to make sure you guys knew that if you dispatch that those phones aren't quite ready to receive yet. They all need to like log in and verify. Here, I'll show you what I mean.
Yeah, I actually had some questions on you on the app usage and how all that works. I don't think I'm intimately aware of it, so I'm feeling a little confused by it.
Yeah, no worries. So I was just going to show you this, and we can take this offline from here if you want, but just the red exclamation mark, like the info's all in, but they just haven't been verified yet. So if they were to send the plan to one of your crews, it wouldn't go to those phones yet. So I was just going to work with you guys through that, and we can do that through a separate meeting. And I don't know if you just want to send Mr. Jordan my way, tell him to come yell at me.
Yeah. Yeah, I can. Yeah, do you have more information? I'll send Jordan on the, as far as the phone